I'm a behavioral scientist by training. My expertise is in exercise behavior change. So I'm very interested in helping people with spinal cord injury become more physically active, and I also study the psychosocial outcomes of being physically active. One of the key things I've done is establish SCI Action Canada, which is a community university alliance of community organizations and investigators, research partners, all focused on advancing physical activity participation in people living with spinal cord injury. Our recent successes has been that the Canadian Medical Association has registered our guidelines in their clinical practice guideline database. So as of 2 weeks ago, that has certainly opened the doors to our ability to reach a much larger range of healthcare professionals in Canada. So the guidelines stipulate that for people with SCI to achieve important fitness benefits, they should engage in 20 minutes of aerobic activity 2 days per week, that's a minimum, and they should also engage in strength training twice per week, consisting of 8 to 10 repetitions of 3 sets of exercise of each major muscle group. These are the first evidence-based physical activity guidelines developed for people with spinal cord injury. That makes me so proud, but one step further is that there's no other disability group that has their own evidence-based physical activity guidelines. The spinal cord injury community is the first disability community to have their own physical activity guidelines, and evidence-based ones at that. Anyone who started an exercise program, someone who doesn't have an SCI, you know how tough it is to start and maintain that program. But when it comes to physical activity for people with spinal cord injury, it's just all that more complicated. There are obviously often the functional limitations associated with an SCI, which just simply means that people with SCI may not be able to go to a gym and access the equipment to have a workout the way that you and I might. So there's the functional limitations, there's environmental barriers, simply getting to a gym, even moving about your community, going for a wheel. It's remarkable how few communities have sidewalks or safe places for a person just to go out and have a leisurely wheel. So those structural barriers, those personal barriers, the fear, I know a lot of people with SCI are often quite anxious about starting an exercise program after their injury. That fear is further compounded if they've never exercised before, prior to their injury. So we do spend a lot of time trying to teach people with SCI different strategies that they can use to overcome a wide range of barriers, whether it's fear, time, lack of equipment, lack of resources, helping people identify those barriers in advance and thinking about strategies to overcome them. We find that's a very highly effective strategy to help them continue to be active when they encounter those barriers. One of the key ways we've done that is we've established Get in Motion. And Get in Motion is a free telephone-based physical activity counseling service for people with a spinal cord injury. The service is available to people right across the country. It's available in French and English. And so what we do is we provide ongoing motivational counseling that really focuses on identifying and overcoming those barriers. We want people to know that when they start an exercise program, we're with them for the long haul, and that's what the Get in Motion service provides. Personally, my research world just completely opened up when I started partnering with the community organizations and we started moving our innovations out into the community. Because you're right, that's the opportunity to really see change, is when what you've developed in the lab suddenly moves out to the community and people are reading the guidelines and they're taking action as a result of the guidelines. There's nothing more rewarding than that. Healthcare professionals are one of the target groups for our innovations and our best practices implementation. But we define healthcare professionals very broadly, so not just GPs or physiatrists, for example, but also physiotherapists, occupational therapists, kinesiologists. And we reach them in a variety of ways. So one strategy we've used is to partner with the Canadian Paralympic Committee, and they have a wonderful program called Changing Minds, Changing Lives. And through this program, they send former athletes out into the community to talk to healthcare professionals about the importance of physical activity for people with disabilities. So with SCI Action Canada's innovations, we've helped embed our information on guidelines and physical activity for people with SCI into these educational resources and educational programs, which the Canadian Paralympic Committee then goes out into the community and disseminates. I just really want to reinforce the importance of researchers and community partners coming together to work on a common goal. That what we've achieved over the past few years through SCI Action Canada, we really couldn't have done this without the researchers and the community organizations working together as a partnership. That's made all the difference.